Hello, everyone. I hope you've managed to have a good break. Welcome back to this afternoon's events. I shall stop sharing the slide. So welcome back to our afternoon programme. We have an amazing session this afternoon lined up. We've had a wonderful networking session this lunchtime, which we've had some really great discussion and participants from all around the world, which has been absolutely wonderful and informative, sharing some ideas and thoughts, and may not be surprising that we ended up talking quite a lot about COVID. I'm going to give you a warning. I think that we are going to be talking a little bit about COVID. It's the elephant in the room in our next session. So we have today got our wonderful In Conversation next, which will be followed by our second panel discussion looking at warnings for organisations. So it is my great honour to introduce Andrew Revkin, who is one of America's most honoured environmental journalists. He is the founding director of the Initiative on Communication and Sustainability at Columbia's University Earth Institute. He has written on climate change and disaster risk reduction for more than 30 years, which is super impressive. So definitely highly qualified for the task, working mostly for the New York Times, where he also founded the popular and award-winning environmental blog .earth. He's also had senior positions at the National Geographic Society and Discover magazine. We are delighted that you're here, Andrew, to be able to interview our guests to talk about health warnings. So I shall pass over to you to chair the next 45 minutes of In Conversation. Thank you.
The usual unmute. It's a great pleasure to be here in this conversation, especially with these two leaders in trying to move from knowledge to action ahead of disasters, in this case, medical public health disasters. And I know they, like I, from a journalistic standpoint, probably spent a chunk of last year in a state of, I wouldn't say despair, but there's something about this process that's sort of like watching a train go off the tracks that you knew was going to go off the tracks a long time ago. You know, as a reporter, I wrote a little bit about pandemic risk in around 2009, avian flu, and written about all these other kinds of looming events that, as a reporter, like walking around Istanbul with an earthquake engineer pointing to buildings, and he says, "This is rubble and waiting." That was his term of art for looking at a building he knows will fall down sometime very soon. You know, Istanbul is overdue for an earthquake. So I just want to kind of lead right into this question that I was here earlier today, and I was glad to see Mia and the folks from UNDR are getting at the primacy of a systems approach here. There's no single story I'll write in the New York Times or no report that the WHO or others will put out that will magically lead to better outcomes. It's incremental, which it's multifaceted, and that can be seen as depressing, like with climate change, but that means there's something for everyone to do. There's an education component, meaning in classrooms on how we teach risk. There's a communication component for sure, a lot of which is about listening more than talking. And there's an iterative approach. And I thought we would start with each of our guests, and you have their bios and the like. I'm going to ask each one a framing question to just sort of set the clock for where they are now. And I thought I'd start with Gail and ask you to offer your thoughts on, given your trajectory, your career, just if you could give a thumbnail journey, what, as COVID emerged, what even now keeps you up late at night or wakes you up in the morning as an unappreciated opportunity or just a glaring threat that's not still being addressed? There's been a lot of learning the past year, but what's job one for you these days, Gail?
Yeah, thanks very much, Andrew. It's quite first of all, it was an absolute pleasure to listen to you there and hear how you have framed the preparedness of the past and what it might look like in the future. So I think I'll need to go away and chew on that. I suppose the one that still wakes me up. So last year I wrote down a whole list of things that I thought might play out in this pandemic. And they've pretty much all happened, apart from the one over, a high proportion of severe disease and death in children. And so that's the one that still bothers me. Maybe partly because I'm a mum and I've got an 8-year-old, and I'm at the school gates every day. So it's I live and breathe that sort of concern. But because I think whether that's COVID-19, a variant, or something else that plays out this winter, where the other respiratory viruses are concerned, as we start to ease up on the non-pharmaceutical interventions, and we get closer to each other, and the kids are all mixing more, and we might see some non-seasonal outbreaks, and perhaps some age ranges affected by viruses like RSV, that perhaps would be a different pattern to normal. I mean, going back, I suppose a thumbnail of my career is, I started off with GOARN 20 years ago, the Global Outbreak Alert and Response Network, when it kicked off at its first outbreak of Ebola in Uganda, up in Gulu. And I was just a hospital jobbing clinician then, but I've never felt so humbled in all my life. And it wasn't my first exposure to, a weak healthcare system, but it was my first exposure to an emerging pathogen outbreak in a weakened healthcare system in an area of conflict, where it was UN security level 4 out of 5. And yet to be met with such dedication and warmth of those frontline healthcare workers was just staggering. And then I moved on from a very comfortable job attached to special pathogens at Public Health Agency of England, through sheer frustration of having to give my frontline colleagues advice on how to manage patients with severe manifestations of a variety of emerging pathogens based on very little evidence. And that was back in 2009, 2010. And I moved over to Oxford in 2012 to help set up this clinical research international group with Jeremy Farrar and the flu guru Fred Hayden. So yeah, I've probably said enough, but as part of, I suppose, through the GOARN lens, I still worry about the people who are vulnerable, those people who are less fortunate than us, who are in conflict areas or who are having to flee their countries for a variety of reasons, who all too often could be forgotten about. And yet, emerging pathogens can impact on them too, and we mustn't forget those people. Thank you.
Sorry about that. I'm trying to keep my notes in front of me and I hid the little unmute button. When the world is seeing a manifestation of the impact of under-resourced countries being last in line and having the most compound sources of risk right now, with the flare-ups in parts of Latin America and Africa, what happened in India recently, India has a pretty amazing healthcare system to some extent. Rural healthcare workers, there's millions of them, but even there you're seeing this. And the vaccine, of course, that's the last place it's getting to. That's a pattern that seems pretty consistent. That just yesterday at Columbia, we started a meeting on what's called managed retreat. So how do you deal with the reality that people will have to move because of climate change? And we were discussing disaster, access to disaster information is there for those who are most able to access it. So the system has a bias toward the ones who are more capable. And maybe Oliver, you could come in a little bit. That was a great snapshot, Gail, from you. I'm going to circle back to a couple of things there in a second. But I think, Oliver, at WHO and the work you're doing, and right now I think there's an infodemic meeting underway right now, sort of the second or third conference. It was great to see the WHO recognize early on that the information environment has pandemics too. And so when you think about these gaps and what success might look like, we'll talk about that. But what brought you to this point now, and what keeps you up right now is this sort of the thing the world needs to attend to that it's not attending to?
Yeah, thanks, Andrew. And just to say, I mean, I think, I arrived at this point well, Gail and I have crossed paths over the years in various outbreak responses, and so in some sense we're cut from similar cloth, and it's seen a lot of the impact at the local level, and it's really very consistent that communities who are affected by certainly infectious disease outbreaks, but other natural disasters and events are often the poorer communities, the more disadvantaged communities, and their ability to recover and respond is also compromised because of the circumstances and situation they're often in. The other side of that is the impacts are very long lasting and generational in time at times. I think in the COVID pandemic, I think there will be generational impacts in education and other societal changes, which are quite difficult to understand. So I think the common understanding of outbreaks is that they're fairly kind of discrete and limited in terms of their impacts, but the reality, is that I've never been involved in an outbreak in any country, in any setting that didn't last many weeks, usually about 3 months. If by the time you detect it, it's over, you're still responding for at least three months, looking for new cases, trying to understand what happened. But many of the events that we respond to last for months and months, or sometimes years. And just as the pandemic started, we were just finishing up an Ebola outbreak response in the eastern parts of the Democratic Republic of the Congo, which lasted 2 years. And major effort underway. And of the 13,000 cases, we had 2,500 alerts of potential spillover events from that one outbreak in 45 different countries. Just to give you a sense of how extendable those outbreaks can be. And I think the other reality, which is an uncomfortable one, and one that the likes of Gail and I live with, and it's my job to be vigilant about, but is that there are events happening all of the time. And the probability of another pandemic happening doesn't change because we're in the middle of a pandemic.
Right.
So just as Gail mentioned, we're constantly looking and assessing the risks of influenza, which is another very well-known and pandemic-prone infectious disease, but also other emerging pathogens. And I think the challenge here is to keep up with a lot of that information that's been generated. So on the one hand, the more we learn, the more interconnected we are, the more information there is about what's happening in the world. Actually, in many ways, we get overloaded with that information, whether it's the infodemic type information about different facts kind of circulating in different media through different communications channels, or whether it's kind of real signals of real events that we have to determine are of concern. It's a major undertaking, and I think this space is going to get more and more complex, and the communication is going to get more and more challenging. So I think it's a really great time for us to be having this conversation, and a really great time for this meeting.
You brought up something that rose to the foreground in one of the conversations I led on this Sustain What webcast I do. Fairly early last year, I had on a couple of U.S. national security veterans, Rod Schoonover, who has a background, he's a physicist, has worked on ecological resilience, and he was at the National Security Council for 10 years as an intelligence analyst. And he was talking about, I think they had 2 or 3 of their recent global threat analyses had essentially had this pandemic in them. And he said the problem is you have this sort of page 21 effect, just what you were talking about. Even within government, you have competing priorities, you have build the wall people and other, what's going on with Russia and other aspects of the China question. So he said that and this is a journalist, I know I've done this too, where you inoculate yourself. I've written stories about Earth, the next asteroid that's going to hit the Earth. So someday I'll be able to say, oh, see, I knew about that and I warned you. But then how do you prioritize that in action within a governmental or agency environment? Seems totally challenging. Gail, I mean, the network that you're developing, GOARN, I love that network approach because, well, there's several things about it. It can be adaptive. In other words, when people are talking to each other, even if something unexpected arises, then you're talking to each other. You know who does what. FuseNet is a famine early warning network for climate, people focusing on agriculture and climate. So does that give you some comfort level that capacity, if we can build that capacity, is that sort of the digital immune system?
Yeah, I mean, I suppose that's probably why, you know, my work, which it feels like more than full time, is across 4 networks of networks. You know, I work with an international network of funders, responders, researchers, and now preparedness. And so, yeah, I mean, I'm totally on side with you. I think it gives you a capability to have an ear at ground level. So first of all, you listen to what the local people are saying, you understand their belief system, you understand their needs and their frustrations, that you see them as we should, as equals, and that we're there just to support them. I mean, Oliver will probably speak to the more formal approach of all the good work, you know, his team does over the grading and so on. But GOARN's secretariat has sat in WHO headquarters, you know, for the whole 20 years. And we're not WHO, but we work very much, you know, hand in hand with them at country level, regional and headquarters level. So, you know, Oliver and I have just spent the past 2 days on the GOARN, you know, 6 monthly steering committee meetings and discussing and listening to people like, you know, Mike Ryan, so that we can try and help to be that ear and that hand at that community-based level across multiple disciplines. It's not just a network of epidemiologists. I mean, we need good epidemiologists, but it's, you know, it's clinicians, it's infection control, it's social scientists, it's risk comms experts, it's logisticians, it's laboratory experts. And as Mike reminded us, I think just yesterday, the reason it was set up is because no one institution can do it all. And I think back then, 20 years ago, you know, the regular players who were going out to support the countries, you know, like US CDC, for example, you know, they all realized that collaboration was the way to provide the best result, to best serve the populations that they were trying to support who were facing these outbreaks.
You both mentioned Ebola earlier, and I wanted to zoom in on another, what seems to be an important trait in dealing with emergent risk, where there aren't a lot of answers, and often there are more questions than answers, which is an adaptive capacity, sort of looking at what's going on the ground, as you just said, but being able to sense signals, community stress, distrust, you know, this whole idea of trust, trusted messenger, hits really big roadblocks when people are stressed out. That's why in America, even Van Morrison in the UK is shouting no masks. You know, that all gets, a lot of that is about who has trust and who doesn't. And there was this incident I learned about when I was in Geneva running some talks at the UNDRR, the disaster risk reduction meeting there last 2 years ago, just before pandemic. And the Red Cross, the head of the, I can't remember his name, a head of one of the Red Cross UN entities was describing this situation with body bags. And the early days of Ebola, they were black, and people there in the regions that were affected bury their family members in white sheets. And so there was an observation, they weren't trusting that, so they went to white. And then there are other iterations. I don't know how familiar either of you are with that particular example, but it felt like the kind of sort of sensory apparatus feedback mechanism that seems vital. Maybe Gail and then Oliver.
Yeah, and I've heard similar stories where actually the color white has meant something else, but that's why probably, I mean, at the first outbreak I went to 20 years ago, WHO had anthropologists as part of the team. You know, we were delighted to have Hough and his wife there, who published a lot on that Gulu outbreak, and we're really trying to understand, you know, how did people understand germs? You know, where did they think the Ebola had come from? But also that mistrust or that broken trust that you speak about, Andrew. I mean, one of the reasons, you know, the international team was essentially chased out of an Ebola outbreak in Gabon in 2002 back into the capital was because people were like, well, where are you the rest of the year when we're dying from malaria and cholera and potentially measles? And yet, you know, and I saw the same sort of response happen in Angola, where, you know, the people had just come out of 30 years of civil war or whatever. So, you know, I think we expect a lot from these local communities. And in Kosovo, I remember being there for Crimean Congo hemorrhagic fever. And my friends, you know, said to me, the clinicians and nurses, Gail, you're always going on about to do this and to do that. We're glad we're alive. We have bullet holes in the walls of our houses. And again, I mean, it makes me feel a bit emotional just thinking about hearing these things, because what are we doing? You know, and it has to be more about, my goodness, if we don't get it right on the back of this pandemic as the global community with solidarity and really drop all the jargon, you know, and actually turn your words into actions and get behind these countries and the populations, and let's really try and make things more equal and sustainable, because, you know, as you said right at the beginning, Andrew, there will be other big hits. It might not be an infectious disease pandemic that's the next one to hit. And I think Oliver said as well, you know, or things can happen at a regional basis. Or it could be, you know, I'm here in Scotland, maybe something happens here. You know, we can't take any of this for granted, but we have to work better together. And it's really about collaboration and coordination that goes along with that communication.
So Oliver, the one thing I've also noticed, and this came up last year from a friend of mine, Laurie Garrett, who's written about the coming plague since 1995. And she had written a piece in The Lancet, a journalist, but she's really dug in as an expert in this too, on the underinvestment in communication and networking. I think there are 6 people at WHO working on tracking the social media landscape. Maybe it was less than that, it was like 3. And even at a university, when we think about grand new projects, at Columbia, they're building a climate school, and faculty tend to think, oh, who are the superstar professors we can hire? As opposed to, how do we invest in the infrastructure that allows us to do interdisciplinary work? You know, who are the people who can help us, you know, write a grant that has anthropologists and physicists in it? And it's that interstitial tissue that seems crucial to these issues. So the world has that basic capacity to not just be there for the emergency, as Gail said, but to be fostering dengue health, you know, as well as Zika health. And is that one of the grand challenges here? It feels like a grand challenge to me that it still doesn't, the world doesn't seem to understand you have to invest in those capacities. They're a little more boring, but they're really vital.
Yeah, thanks, Andrew. I think that, you know, there are a number of challenges within your comments, and, you know, to lead off from where Gail left, you know, all outbreaks ultimately, or all pandemics ultimately, are really controlled at the local level. It's, you know, in our communities, whether it's your community or a community in a country you've never heard of, you know, outbreaks are really controlled by individuals living in their communities. And the significance of that is that we must really embrace a lot of that diversity of people's circumstances and their understanding, and the information that's generated from our public health systems, but also, as you mentioned, from our, you know, other communications channels, whether it's social media channels or whether it's through, you know, through radio or through other forms of communications among communities. So I think you know, when we're now moving at least our way of understanding in terms of public health from, let's say, a traditional surveillance concept, which is, let's say, talking about counting patients in hospitals, to something much more better summed up as collaborative intelligence, where we take information from all sorts of different parts of our society and at different levels of our society. And that's relevant to understand what risks are and to assess risks. And then by having that engagement up front, you have a much better way of interacting with your communities, when you need to. And I think we can all think of examples. I can think of examples in my own career where that lack of community engagement was hugely problematic in my home country, which happens to be the UK, just as much as any other country. And these are real challenges. The other dimension to this is that, if we're taking a much more expansive and holistic approach to understanding risk, then our workforce needs to change. We need to value different skill sets, whether they're from the more community-based skill sets or sciences with a more community focus, or whether they're more, let's say, hardcore data science skill sets. And one of the challenges, the grand challenges that we now face in public health, is that in the contemporary world, the larger interconnected world, we just don't have a contemporary workforce that interacts with all of those different parts of our society in the way that we interact with our society. So I think, when now we're looking forwards, and Gail summed it up perfectly, is that we really have the moment to learn some of these lessons and make those investments and communicate with our governments and our leadership about what those investments should be. We must think about younger people who are coming into their professional lives and having a much more broad-based approach to what we mean by public health. And I think that's probably our biggest challenge. Sorry, and Andrew, I think you missed the mute button there.
Thank you. There we go. My dogs were barking, and I don't want that risk reduction. What I was saying is part of what you described there seems to call for a new level of professionalization. Columbia has a school of social work that's actually going to be tied in pretty significantly to the new climate school. And I think when you think about climate adaptation, or in this case, essentially pandemic preparedness, is not that different than preparing for any other event where local behavior matters. The scale of what's needed in an interconnected world, whether it's viral or CO2, it feels like there's really new levels of professionalization, a new degree granting track or a certification process for someone who's like a public health or resilience professional. Gail and/or Oliver, I don't know if that makes sense to you.
Yeah, I suppose it made me think about something that you said earlier about that interdisciplinary approach, but also opportunity to make and create the opportunity. And we saw it happen in clinical medicine. When I started out nearly 30 years ago, we were kind of all generalists, and there was less specialists. And then as I got older, I saw us become very siloed into our specialties, and there was less crosstalk. And I think that's changing again. You have the multidisciplinary group meetings. You have to create an opportunity to understand each other. And we saw this happen at WHO during SARS in 2003, when I was part of the clinical team, and we had the clinical team, the lab team, and the epi team, and we all had big international networks. And whenever we were writing guidance, the more time we spent with lab and epi, we would make sure that we included what they needed or what they were trying to explain into our documents. But that came over time, working with each other, of listening to each other, creating the opportunity to be able to listen to each other. So I'm not so sure if we need lots of new. I think we need to get ourselves better organised to create the sort of things like opportunities that would enhance coordination and communication, and really at that, not only from kind of the top down, the middle bit, but also as Oliver's been describing as well, that bottom-up approach. And I think we need to give a lot more thought about what do we actually mean about being people-centred, about being community-centred. What really does global health security at a local level mean to you and I as a member of our local populations? And that may well mean something different to you versus me, because we're in different contexts, and versus someone in the Philippines or elsewhere. And so I think we need to do a lot more thinking over how do we actually better organise ourselves. And a lot of those recommendations that, you know, good people have spent a lot of time putting forward, actually a substantial proportion overlap with the recommendations that came out on the back of the West African Ebola tragedy. So why weren't things, why weren't they all implemented? Perhaps there wasn't a need, or perhaps they weren't for a specific reason. But my goodness, you know, I think we really need to get it right going forward. And it's probably going to be even more than some of those recommendations. But going back to, for example, just one of them, the Global Preparedness Monitoring Board, who raised that flag high, September 2019 at their inaugural, said, you know, we are a world who's not prepared. And they want to see citizen engagement go forward. And it has to be at the heart of. We have to figure out how to do that best.
Okay. You cut out slightly there at the end, but I think we caught the gist of it. The one last thing I'm going to throw in, and there's some really good questions in the chat, is the need to run the drill. Again, when I was running a session last year, I think it was Alice Hill, who used to be on the National Security Council. She said two things that are germane. She was very happy that President Biden was pledging to make his science advisor a cabinet level person. And it's not to sit there and hand out reports, it's to be in that regular conversation with the other cabinet members, health and human services, education, blah, blah, blah. And without that gives you that readiness. And she also said, though, you have to run the drill. The big failures in the United States where no one has, you don't do a drill where you're actually checking, well, what's the condition of the ventilators that are sitting in the warehouse? And you only know that if you're actually taking the warning, doing the preparedness, running the drill. And that, you know, extending that out to the community feels important. Let's go to some questions. I don't want to waste more time. There was one, Ray Taylor was asking for you, Gail, just a thumbnail on what GOARN does concretely, kind of like how does that play out on a week-to-week basis? What you can describe that.
Yeah, sure. So as a multidisciplinary, first of all, hi Ray, as a multidisciplinary network of networks, we will receive requests for assistance, for example, from countries who are facing X, Y, or Z. And so we'll respond as a network. Obviously, more recently, it's been virtually, but we may well send the appropriate people to work alongside those national teams. We also have a very active training department who have a tiered approach, which goes from e-learning opportunities that people could look up to the highest tier, which is focusing in on leadership and some of those softer skill sets, but that are probably equally important, and to make sure that you can actually get people to communicate and collaborate well under stressful situations. So that's just a taster. We also have a research arm and various other working groups.
Another one here is, well, we're going to try to summarize Paul Basson's comment. Do you believe the real concern is, this is about information overload. I guess it's about the capacity to sift efficiently rather than to be sure you have a lot of information. Let's see, approach a single global umbrella. What's the way, when you think of a global network, is there a way to have that distillation happen so you're separating the wheat from the chaff and getting the real signal amid all the noise? How does that work at the global level, or is it ultimately always going to be a distributed capacity? Maybe Oliver?
Sure. Yeah, thanks for the question. I think how does it actually work? Well, what we currently do is, my team is actually distributed across 7 locations around the world, which gives us 24/7 coverage, and we work through about 9 million pieces of information every month that we receive through our global surveillance network. And we look into about 4,500 events that each month that we think are of concern from a epidemic or public health perspective. And they're not all infectious disease events, so it's broader than that. And we end up conducting about 300 investigations a month around the world. So that's kind of what we do currently. We have kind of about 120 events open that we're openly managing as WHO, which is obviously a subset of all events around the world. But the ones that we add to our work list is we have about 120 events open at any one time. So that's what it currently looks like. But clearly, there's more opportunity to have even better handle on what's happening and what those risks are. And our approach, although it's definitely been growing and expanding, and our capabilities have been growing, there's so much more we could do. We can't systematically take into account a number of contextual factors that are very important, because either the information is not there, or the data is not there, or it's just not there in a format that we can look at in a routine way. And the approach that we use is a fairly tried and tested approach, which is the human approach. We have great colleagues who understand different parts of the world and who come from different parts of the world, and they apply their experience, their knowledge to the information they're looking at, and then they know enough to say whether there's something important fact or important piece of information that's missing and we need to go and look for it, or whether to contextualize what we're looking at maybe is of a concern or less of a concern, depending what the context is. Looking forwards, we have really a much more expansive view on where we'd like to go. And actually, you mentioned some new initiatives setting up in Colombia. Actually, we're setting up a new initiative. We're establishing a hub for pandemic and epidemic intelligence. And that effort is really much more around this concept of collaborative intelligence that I mentioned, which is it is a disseminated activity. It's a joint and shared owned activity around the world from the community up. And it's not just in the public health realm either. We have other events that happen in our communities which have public health significance or change the risk condition for communities that we can respond to in a preventive way. And so those are all opportunities that in the more, let's say, more data-driven age, we're able to actually engage in ways that we couldn't do even 5 years ago. But as I mentioned before, it will take a reimagining of what we're doing, a new commitment and a new workforce, or a kind of, let's say, evolving workforce for us to engage in different ways.
There's a question here from Claudia Fernandez de Cordoba. Taking into account the main drivers of the risk of emerging infectious diseases, particularly zoonotic diseases, is linked to agricultural systems and their impact on ecosystems relationships. Could we develop better ecological warnings linked to health initiatives? One aspect of that I wrote about in 2009 was getting veterinarians to talk to public health officials more. So what are we not doing to get better signaling at the very early stages of risk? Maybe Gail, and is that integrated well into your GOARN network, for example?
Yeah, so we do have vets, and we work closely, for example, with OIE and FAO. And actually, when I set up the GOARN research group 3-4 years ago, one of the 6 work streams is One Health. And so, yeah, absolutely couldn't agree more. Again, it's about that multidisciplinary approach. And and earlier this year, I normally teach at Oxford on a simulation exercise on a novel coronavirus epidemic. I've done that for at least 5-6 years. So this year we changed it and went for a zoonotic and worked very closely with OIE. And then we ran the same at the London School of Economics. So just trying to, wherever we can, engage at a more kind of practical level as well. But I mean, I'm sure Oliver can say a lot about that. WHO have been doing a lot of work in that space with their counterparts.
What's OIE, by the way?
It's basically the animal health equivalent to WHO.
Sounds crucial. There's another question from Ray about budgets, like if and/or laws or agreements. Maybe for each of you, very quick. If you had two things, like a discrete spend or some tweak in a law or an agreement that would make things demonstrably feel better, what would those be? Maybe Oliver and then Gail. You can make it one. Make it one. What's the highest wish list thing that's not on the list right now?
I mean, I think there's, Ray also touched on it, I think in one of the earlier comments, and I think the more open that we can all be, whether it's individuals, communities, countries, about what's happening, I think the better. I think certainly gone are the days where information can be completely managed, and there's always some type of communication happening that eventually makes it into a wider sphere. But I think the more open that we can be, the more benefits there are. I think those benefits far outweigh any perceived disbenefits from open information, and I think that's probably that's not a law. It's not a legal thing necessarily. It's not a financial thing. It's more of a change in our collective mindset that it's actually for our collective benefit, and whether that's in the environmental space or whether it's in the health space or any other space, in the long run, in fact, not even very long run, in the medium term, but certainly in the longer term, this is going to be much more beneficial for all of us. So I think it's the collective, if I try and reframe that a little bit, I think it's kind of the global good view on public health. I think it's something that we should really embrace coming out of the pandemic, in the way that I think from environmental health, the concept of the global good for environmental health is now well established. I think we haven't quite got there yet for public health.
Gail, a particular initiative?
Yeah, completely support Oliver and what he said there. So to try and think of something different, and I'm certainly no expert in it, but I think I would probably try and pull in the experts on IP and data rights. So not just IP, the associated data rights with that, because things like the TRIPS waiver, etc., probably won't be enough. And to try and find out what actually would help, what changes would help, to make sure that those who are less fortunate, that some of us in the West can have access to, whether it's therapeutics or vaccines, etc., a lot quicker. Obviously, the manufacturing capability and all the, the supply chain issues have to go with that. But if I was to choose one thing, in memory of my colleague who passed recently, who brought this really to my attention for the low and middle income countries, so Kieran McGinley, IP and data rights is what I'd really put under the microscope and get the people in the room who are the experts to look at it.
This is a great, we're right at the end, sadly. I could do this for another hour or two. And I made a note to follow up. I do run these other webcasts, and I'll be launching a column next month on this kind of issue, so we can keep this going. Anyone who's posted questions who didn't get them answered, hopefully someone will save all that stuff, and we can keep in touch by email and Twitter, etc., and get at some of these. The one thing if we have time to squeeze in one last provocation for you both, it's is there an extra governmental potential that's now arising that could ease some of these questions? You know, China and the US are never going to be talking easily to each other, sadly, but there was a Boston University professor early last year, I can't remember her name right now, who was tracking using public satellite data, patterns of activity in the parking lots of hospitals. And it was clearly something was going on. This is the fall of 2019. So there's all this information. Same thing with deforestation. There are high school students in the US who identified deforestation, gold mining intruding into an Indian reserve in the Amazon, and that led to a Reuters article and led to pressure on Brazil. So we're in a world where some of that, not everything can be transparent, but we have this increasing capacity as a global community to sort of take these signals in and do things with them. Does that excite you, or does that feel like a false promise? Maybe just a last quick thought from Oliver and Gail.
I think it's hugely exciting. I think it's really a very promising way forward. I think coupled with the fact that coming through this pandemic, there's been a huge increase in our collective public health literacy. We have, conversations, I have conversations with my family about lateral flow assays, which it's extraordinary to me. But I think the role of some people call it citizen science, or the engaged member of the public is vital. And I think it's a really, really positive step. I think it pushes all of us, whether we work for a public government institution or a non-government institution, to really engage in these issues in a much better way. So I'm all for it.
Great. Well, I think we're at the end, but it's just the beginning. None of these conversations I've been hosting lately are a done deal at the end. They just lead to more opportunities. And I think we're on a good track here toward having a more resilient planet with some better capacity to do a little bit better next time than we did last time, although I can't guarantee success. Thank you for having me be part of this.
Thank you very much. Enjoyed it. Thank you.
Thanks, Andrew. Thanks, Gail.
And thank you very much indeed, Andrew, for guiding us through the extensive experience that sits with Oliver and Gail around health warnings. And of course, the whole point of today really is to say that this is the beginning of many conversations. This is the starting point, and there are so many conversations to be had, and we very much hope to be having more in-depth conversation around health warnings over the next year. So thank you very much to all of you for fascinating in conversation indeed. And also thanks so much to Gail and Oliver, who are so busy, obviously in the middle of a pandemic, and let's just hope that wish you the best of luck in terms of helping us navigate us out of this, and let's hope it's a while to the next pandemic. That's my main fear. So what I'd like to do now is to pass on to our next session, which is our second panel, which is looking at warnings for organisations, and Dr. Gianluca Pescaroli at the IRDR will be heading this panel. So I pass over to you, Gianluca.
Hi to all and welcome. Good afternoon or good morning or good night, depending on where you are. It's a great honor to be here today. I'm Gianluca, I'm lecturer on business continuity and organizational resilience at the Institute for Risk and Disaster Reduction. And I'm the director of our Masters in Risk, Disaster and Resilience. I'm very proud to lead this session, and I'm looking forward to it because to some extent, it naturally follows up and builds on what Mami and Oliver were suggesting. For how complex systems are, we need to engage together and be the change we want to see in disaster reduction, putting together our expertise and talking together. So our research group did already some work, in particular on how to integrate earthquake early warnings into organizational resilience and continuity practices, in particular with the colleagues of engineering. But we are still seeing that the perspective is limited. We need to interact more, and we need to learn from our colleagues that are professionals, that are practitioners, both from the public and the private sector. This is essential because it's not fully understood, and in the moment we need to, and we aim to make more useful our research, that's the starting point, and their experience and their research is what we need to build upon. So in this session, we will focus our discussion on understanding the existing gap in warnings, the warning potential, and what has been used, what has not been used, what we can do better. We will do this building on the experience of the panel and trying to adopt an all-hazard approach, maybe even being a risk agnostic, if you know what I mean, or otherwise I will answer in the question on this. We were thinking about future proofing. We will reserve the question and answer at the end, please. And we have some rules of engagement. Most of our speakers do not speak on behalf of their organization. And we are not going to cover questions associated with, for example, vaccine policy or politics. But we will try to build on understanding of the complexity based on their experience. Use the question and answer box, and we'll try to answer as much as we can be had. We have one of our colleagues that couldn't make it because she had to respond to a major incident. That is Angela French from PUK, and our colleague Jeremy Reynolds from London Resilience is trying to connect as soon as he can. Jeremy is also our part-time PhD student. But for the moment, I would like to introduce my speaker. Can you have please a short roundup of introduction? Andy, you go first.
Certainly, yes, and hopefully you can hear me okay. Hello everyone, my name's Andy Marshall. I'm the global process owner. It's a lofty term, but I'm, I guess, the lead for business continuity at AstraZeneca. And I've been at AstraZeneca now for just over 3 months. Just as Gianluca said there, I'm not representing AstraZeneca here today. What I would like to bring to this discussion is very much about my experience over a period of some 20 years now of dealing with business continuity and wider crisis management and resilience activity in all different forms, from a short career in the military through to a frontline public sector role in resilience and also private sector consulting as well. And immediately prior to joining AstraZeneca, I spent 5 years as the lead for business continuity and crisis management at Rolls-Royce.
Catia?
Yeah, I'll go next. Hi, everyone. My name is Catia. I am Director of Global Resilience for IHG Hotels and Resorts. I've been with IHG for nearly 10 years now. I'm very lucky to have an amazing team that works with me. I'm essentially responsible for crisis management, business continuity, ERM, and something we call strategic resilience, which is essentially long-term risk management. So trying to future-proof emerging issues, just strategic resilience from an enterprise perspective, if you will. So we try and look at long-term risks. That's my scope, and it's similar to Andy. I mean, I'm here to speak from my perspective, but most of my experience is with IHG, but I don't speak for them. But yeah, hopefully bring something useful to the table.
Okay, hi. My name's Emily Hough. I'm founder and editor-in-chief of the Crisis Response Journal. And this is a publication that looks at all aspects of the disaster and crisis cycle from a multidisciplinary perspective. And we really aim to bring in perspectives that aren't traditionally considered to be disaster related in the purest sense. Everything from design, economics, sociology, anthropology, psychology, and much more, so that disciplines can learn from one another. And that's why I'm so excited about the conversations that have been happening already today, because there's so many areas that we need to explore, the issues of trust. I was delighted to see near-Earth objects mentioned already, and I hope we can carry on exploring those. But back to CRJ, the aim is to stand back, get an overall impression of the whole picture, and then try to extrapolate possible connections between events, risks, and major crises, and thereby hopefully helping to predict trends and future hazards. And we do this with the invaluable assistance and expertise of our advisory panel, 2 of whom are on this discussion panel. And I'm speaking for myself, but also as editor of the publication.
Jeremy? You're on mute. So I will introduce Jeremy shortly because I know him very well. He's one of the deputy head of London Resilience that is the group that coordinates the information for London, and is our part-time PhD student working on organizational resilience and adaptation with me. It's been one of our strongholds in the last year, in particular for scenario exercise and the strategic call command. So, okay, you still cannot speak. As you are all seeing, we are already in the mood for warnings into organization. The more disruption we have, we more understand the relevance of warning, or how much time before we were able to take action, like my speaker having a major incident to deal in our organization, Jeremy stepping in and going on with this. But the first question for the panel then is, what are for you warning? What are, based on your experience, are they linked with sustainability? And I know you want to start on this.
Yeah, it's a fascinating topic, Aaron, and I've actually listened to some of the presentations earlier on today, and for me, I feel reassured because some of the ideas that came to mind when we first spoke about this panel, I don't feel like I'm going to be too radical, which is great. I'm in good company, it seems. For me, warnings, I guess, split into three main levels: the strategic level warnings, the enterprise ones, and the individual ones. And we'll probably get to the enterprise and the individual ones later. But I really wanted to just raise, I guess, for me, the strategic element in response to this question. As I said earlier, I've been doing business continuity and crisis management for some 20 years and responded to a whole host of incidents during that period. What I would say, though, is that throughout that 20-year period, in the various roles that I've been in, there is something that stayed with me, and that is the preparation for a pandemic. So following the WHO guidance, following the structures, putting plans together, getting those plans exercised, and so on and so forth. So I guess for me, I heard in the previous presentation the page 21 effect, and that's certainly something that I think I've come across. How do I know that I've come across that? Well, when the COVID-19 outbreak started, I was quite surprised to learn the number of organizations that stepped forward, organizations, individuals, communities even, that said, you know, we weren't aware of a pandemic. We weren't aware that this thing was such a big risk. And that sort of gave me a period of reflection, because I was thinking, well, as a practitioner, I've been communicating this, and so I've a whole host, you know, thousands of people similar to me around the world have been doing this, but the message doesn't seem to have landed. So yes, the warning, we were aware of it, the warning, we were communicating it, but it just didn't seem to be getting through to the right people at the right time. So I know we've got a lot of esteemed current and potentially future academics on this call, and my plea to them would be, I think there's a fantastic piece of work out there for people to look at, which is around saying, how do business continuity and risk practitioners, crisis management practitioners, how do they communicate key information to organizations, to boards, to risk and audit committees, to communities? We mentioned earlier about the importance of them. How do they communicate that message? That's one side of the question for me. The other side of that question is where that message or that question lands. So when it gets to a board, when it gets to a risk and audit committee, when it gets to a community, what is the expectation that people are doing about that? Because my reflection about the warnings over the last 20 years about pandemics is, you know, people just don't, I guess in some cases, seem to have understood that message coming through. One thing I have heard briefly, Gianluca, is that the message is probably too big. It's too complex. It's bad news to the nth degree, and therefore the human brain struggles to actually deal with that. But I guess at the risk of being slightly contentious here, there's a wider perspective for me about the future here, and that is that these warnings will come thick and fast. Why? Well, quite simply, bad things will happen in the future. And if you take that experience of the pandemic warnings, and I just scribbled down in the previous presentation some of the things that I think we should be thinking about: cyber risk, space weather, artificial intelligence, climate change. They are all huge meta strategic risks. and they all have a significant amount of credibility attached to them. There are warnings attached to them as well by academics, by scientists, by practitioners. My question is across all of those, for example, what are we doing about those?
That's a great question, and I don't have a particular answer, except the fact that, again, risk agnostic, understanding which are the common elements between different risks and where we can act for the known and unknown. That's less my take. But I will leave to follow up, first of all, to our fellow in the panel. Catia, do you want to go next?
Yeah, sure. No, a lot of what Andy says obviously rings true. I mean, there are warnings in a lot of areas, and pandemics wasn't a different aspect to that. I do think that realistically speaking, though, unfortunately, companies sometimes do have to prioritize their attention. And I'm not saying we do this like to a T, not at all. Everything, everything has a room for improvement, but you do have to prioritize at some point. And I remember a presentation earlier today talking about likelihood and impact and how those matrices work. It's a very, very interesting area to actually figure out what is a warning. So I tend to emphasize a lot the importance of intelligence when it comes to this. So I think sometimes with the nature of the work that I do, people just expect me to go into a room and say, here's something you didn't know. And a lot of the times, actually, the warnings, to Andy's point, are there. You're just not addressing them, or you're not prioritizing them, or you're not doing something about them, but they are there. It's very rare that you actually put something that's an emerging issue on the table. That's not something people have never heard about. So I do think that there's an important note, that distinguishing note to put there around what is a warning. And just genuinely, when is it so much when do you identify it, or when do you actually kick into action a response to it, or whether that's a prevention response or an actual response. But to me, I think one of the big things, and this links with that question on sustainability as well, Gianluca, it's kind of like, for us, it's a sustainability versus a viability kind of question, I think sometimes. So it's a viability of the company long term. So when you're trying to look at warnings, and to Andy's point, you do look at things like climate change, and you look at it not just from a disruption perspective, but also from a corporate citizen angle, from a guest experience perspective. There's a lot of areas that go into this, but obviously we're focused on risk, if you will. Just one final thought on all this. One of the big things for me on what a warning is just like a heads up for people. Sometimes it can be something really small, snowballs. I find that a lot, at least in our line of work, being a global entity. A lot of the times a warning may be something that you might not ignore, but maybe disregard as important, because it's just it's kind of a small thing that has the potential to have an intelligence approach. The more you know, the better informed you can be to identify what a warning actually is for you specifically. I'll leave it there. So this is just my reacting to Andy. I could go on, but I'll just leave it there for now. Emily always has good insights, so I'll just defer to her now.
But yeah, it's a very good point, and I see somebody in the question and answer already build on this, and we're gonna take it back later. So Emily.
I'm really glad that Andy and Catia went first, because you sort of crystallized what I was thinking. The first thing I did when we decided upon these questions was sort of retreat to my old stalwart dictionary and get the definitions out. And I was trying to come up with sort of, as Catia says, the difference between warnings and alerts. And we've talked about alerts quite a lot earlier on today. And I'd say that obviously warnings are indicators of an issue, which if you act early enough, you mitigate or avert the crisis and people are kept safe. Alternatively, the crisis occurs and then you look back and say, oh, all those warnings are abundantly clear. And I think, with regard to the question, what are warnings? It's one of the things that I'll just add to what Andy and Catia have said. It's very much, warnings start small. They're not gift wrapped in a big red package with hazardous tape all around and flashing lights. They're tiny little things that someone goes, oh, that's not quite right, but they don't think to say anything because they're busy or they're working or it's not their place within an organization to say anything. And that's why I think people are so important in all of this. You know, they're at the center of everything. Any community, any organization, any risk, all comes down to people and how they're, you know, how aware they are of things. So, and there's one other point I'd like to make, is that it's sad when warnings have been picked up and a crisis has been averted, because people don't talk about it enough. They either want to keep quiet about it and go away quietly and think, not going to mention that to anybody. Or, but, you know, these are the positives, and we don't show the positives enough of when warnings have worked. And when hazard alerts have worked, everyone just gets onto it and moves on to the next thing. And we also look at when warnings go spectacularly wrong, like the infamous Hawaii false missile alert of 2018, which is, I'm sure, is all, you know, everyone's aware of. And I suppose what I'm sort of picking up, and I've picked up through the day, it's the misinformation, it's an issue of trust, it's the human psychology, how we cling to the safe and the familiar, how our brains can actually override warnings, and we see what we want to see. We make the world fit what our expectations is, and this can all play part in ignoring warnings. And I do, I'm sure everyone here has read, and I'm sort of passionate about her books, Michelle Walker's The Grey Rhino, in which she characterizes a grey rhino event as a high probability, high impact event that's ignored. And I think that's the perfect framework for this discussion as well. And one last thing on sustainability, I think Catia sort of pretty much summed it up as well, because I see sustainability as inextricably enmeshed within resilience, safety, security, climate, and back to people. It's the ability of communication, communities and organizations, i.e. people, to thrive, live in peace and security, keep their families alive and food on the table. And for organizations, it's about the ability to carry on with what they're doing and remain viable. So everything here we're talking about is interconnected: warnings, sustainability, and the whole panoply of measures that have been discussed.
That's a very good point. Everything is definitely interconnected, and the way we are dealing with it and the way we identify the vulnerabilities out of it is what makes the difference at the end to address the escalation process of events. Jeremy, are you now available? Can you speak now?
Can you hear me now?
Oh, great.
Excellent.
So thank you very much for joining with us with half an hour notice. You've been great. What is your take on this? So just a reminder of the first question. What are for you warnings, and are they linked with sustainability?
Thank you. Yes, so just a super quick introduction. Apologies for the delay in joining everybody. I work for the London Resilience Group, and we are hosted by the London Fire Brigade. If you haven't worked out, that's why there's enough background behind me. And our role is supporting the work of the London Resilience Partnership in preparing and responding to emergencies. And that London Resilience Partnership is made up of 200 odd organisations. So the breadth of responders and those who are obviously will all be familiar with the Civil Contingencies Act, both the Category 1 responders, the traditional people you would expect, like the emergency services or the Environment Agency, the local authorities, but also in the Category 2, the utility companies, the transport hubs, those sorts of things. My role specifically, I'm one of the deputy heads within that team, and I'm responsible for a lot of the work relating to risk. So I chair the London Risk Advisory Group. So there are risk assessors from each organisation on that group. I'm also involved in the partnership lessons process and also exercising, amongst other things. So warnings is not a core immediate area for me, but of course it's inextricably linked to all of those things, which is what the other panelists have been talking about. For me, warnings in some way are formally driven by risk, and we see that by organisations being responsible for specific risk. So we have people like the Environment Agency who will be responsible for notifying people about flooding. We might have you would obviously have the Meteorological Office responsible for weather warnings and that sort of thing. But of course, it's so complicated and so integrated that we all have a responsibility to play in responding and protecting the public. And therefore, whilst those specific risk communication and warnings might be down to individual organisations, there's a really big effort to support that and make sure messages aren't make sure messages are shared, make sure they aren't contradictory, and that sort of thing. In terms of warnings, there are obviously key formal aspects to it, such as warning and informing, and we've had some good discussion this morning around, okay, what happens after warning, what happens between warning and then effective response. And for me, we sort of, in the sort of practitioner world, we use this term informing, which is, you know, making sure that the public are aware, understand the risk or the risks involved, and understand what their options are, what possible actions they might want to take, and what responders are doing on their behalf as well. And obviously early warning systems is a part of that formal portfolio of sort of warning work. But as Emily mentioned, there's a whole host of sort of informal stuff going on as well. So particularly for me, lessons, it gets sort of those indicators that say, actually, is this a warning that we're not paying enough attention to? So that's certainly something we need to pay. You know, it's not just about those formal structures. And again, as Emily said, the processes are only so good as the people using them, and there's a massive human element to it around good judgment, paying attention, and responsiveness. You know, and that's both for responders, but also having the trust of the public so that they'll respond to our warnings. Sustainability, just lastly then, sustainability, yes, absolutely. I think, as the other panelists have said, totally linked to resilience. I think it's sort of, I'm sure there are people with us today who will be able to explain the differences, the nuances between the two, but I see them as very similar to each other. And I think almost resilience is now the word that's almost replacing sustainability. And there's a big challenge, I certainly find in my field, where we're looking at the immediate stuff, and actually we've got longer term warnings. How do we integrate that with what we're doing right now? And that is a challenge. And response versus resilience is, I think, where we're at now, and there's a whole host of work being done to try and bring those two things together.
Thank you, Jeremy. Definitely makes sense. And when we think about resilience and when we think about the role of information in creating resilience, then it brings the conversation also to consider if global warnings exist. I've seen also that there is already one of the question and answer in the box, one of the questions in the box that is partially referring to that, because do you in this panel think that global warnings exist? If yes, no, what are the limitations and the strength? I mean, we live in an interconnected society. We see cascading effects all across the world, in particular with the pandemics, but what is your take on this? Let's follow the same order before. So Andy, you go first.
Yeah, I mean, I think I've mentioned the classic global warning for me overtly is the one through the World Health Organization about a pandemic. You know, and the issues we had with that were around, I guess everybody was waiting for that flow of information to go through their plans, but actually didn't really, for me, kind of follow the same sort of construct in reality when it came to COVID. Now, that's not being critical of the WHO, far from it. I think actually if we'd have followed it more to the letter, we'd have probably been in a better place a lot sooner. So maybe there's a reflection there on the efficacy of those warnings. I think I'd also come back to something that was mentioned in the previous panel about the gathering of information and the collation of information and being better at collating that on a global level. Now, I'm interested to know what that would mean and what that would look like, and I'll probably cast some of my own experience on that. Even dealing at a very low level, community-based incident, the amount of information that you get from that across multiple platforms, be they radios from responders at the scene through to the photojournalists that we now all are, because we have a mobile device and we have access to multiple social media channels. The ability to overwhelm information systems and processes, I think is quite acute, even at a local level. How you would therefore transpose that to a global footprint, I think is a significant undertaking, and would, yeah, I'd be fascinated to see how that would work. And then you get the whole thing there about efficacy of message, timeliness of message, trust in that message as well. But for me, I think that the challenge is always about whatever information you get. It's about turning that information into intelligence as quickly as possible, and that takes a significant human intervention as well. You know, you need trained people who know what they're talking about, who have experience of incidents to know, okay, fine, what this is really telling us is as follows, to turn that into intelligence. And for me, that intelligence piece then enables you to get to that lovely question, which I always ask people who are working for me or with me. I always get them into the routine of asking that question, not once, but constantly. And it's a simple question. So what? What does that mean? And therefore, what do you need to do about it?
Catia, do you want to follow up on this?
Yeah, no, it's, Andy's covered some of the areas I was going to mention as well. It's a really interesting area, to be honest with you. Look, there's a lot smarter people than me on the call, I'm sure. So apologies if I'm slightly controversial. I'm not, and you can disagree with me all you want, I'm not entirely sure global warnings do exist, to be fair. I do think that there's warnings that can be given for any parts of the world, yes. And I do think that there are global events, yes. Whether there's an actual warning that goes out to the whole world at the same time for the same level of impact is what I'm referring to. That part I'm not sure. Even with the pandemic, you know, it snowballed. It started in one place, then it started moving. And as a global company, you know, I can actually tell you we could see it moving. So there were warnings in that sense of, you know, it's coming, we know it's going to be a global issue, yes. But it wasn't entirely like global to begin with. I don't think we could have predicted, again, please correct me if I'm wrong, but you know, we could have predicted the exact impact that it had. We knew it was going to be big, we just didn't know how big. And to Andy's point, most of the times when you're in a situation like this, you get so much information and it's really, really difficult to make decisions based on the information that you have, because you have to, absolutely, I agree, I'm much more a fan of intelligence than specifically warnings. But it's very difficult to make decisions based on what you have at the moment. And so it's kind of like, you know that something is happening, but there is a limitation there very much so. And I think it was the keynote speaker that mentioned one of the bad things, if you will, of human nature is that if it's too complex, people tend not to deal with it or tend not to know what to do about it. And with something that's big, I do think that, you know, just by the very nature of people or businesses, we tend to focus more on kind of what's in front of you or immediate future. And it's very difficult to think about the horizon scanning as well. You have people looking at it, but it tends to be like, what do we need to handle? What's the next big one, if you will, that's immediate for us? And one of the things we're being told by intelligence is that this pandemic wasn't actually the predicted one, which is one of those things that does actually keep me up at night. And to Andy's point, you do kind of go, so if it happens again now, would we be better prepared? So you've had a warning, you've had an experience. So are you better or worse? So having the warnings definitely helps, but I was going to say it's limited in the sense that there's only so much capacity to handle and manage things, but it's definitely a plus, right? Because if you know that something is coming, it does give you a heads up to try and prepare for something and prioritize your efforts to that. So I do think, just as an example, just because it's so recent, as the pandemic came, we could see what was happening, so we could genuinely warn the next region of what was coming and what the best methodology was to handle it. So yeah, I'm still one of those things, one of those people that, in my mind, and to Emily's point, I think earlier as well, I still believe that the next big issue, if you will, and you know, I'll probably be proven wrong, but the next big issue is going to be a compound of things. It's going to be an interconnectivity thing. That's the most likely big issues to happen, if you will. And even with COVID, if you notice, obviously it was a pandemic, that's a big crisis, but the knock-on effect, whether it was on mental health or culture or economics, it was huge. There was civil unrest. There's a lot of issues that come as a knock-on effect to that. So the crisis itself is actually multiple parts. So you get a warning, but there are stages that you need to go through before, during, and after. And so I think getting that heads up, if you will, is definitely a plus, but it doesn't solve everything.
Yeah, it makes sense. Emily, do you want to add something? What is your point of view on this? I see that you are ready and waiting for it.
Oh, absolutely. Poised on the button, poised on the mute button for everyone. You can mute me now if you want. No, I agree with both Andy and Catia in that I think it's back to the definition of warning, isn't it? We have a lot of signs. There are a lot of signs of impending doom and so forth, and we certainly had them with regard to COVID. There were so many warnings. We saw videos of the early stages in China. If you go back to SARS, MERS, and I wonder sometimes if we've actually got too many warnings, that they're just not being listened to, or they're not being listened to in the right way. And that's back to sort of warning fatigue. And one of the things that I was reading the Manchester Arena Inquiry, the first volume yesterday, and there was a really notable phrase in there, you know, a high state of terrorist alert had been in place for some time. And people become comfortable with the situation. At first it's scary, and they wonder about their own preparedness and so forth. Then they realize that actually nothing's happened, so your alertness decreases, and eventually you can become complacent. And sadly, that seems to also happen. It's not just a citizen thing, it's a global, you know, it can happen within responders as well. And I think it's about understanding psychology, our predispositions, culture and experience of disaster, and how they all come into play. And I know that Mickey Glantz mentioned risk takers. And I promise you, I'm not on commission from Michelle Wooker, but I have just done an interview with her about her latest book, You Are What You Risk. And something resonated with me about each of us has our own unique risk fingerprint. Our perception, our culture, our understanding, our experience of risk. And if you can develop risk empathy and understand whether communities or individuals, it means that you can actually engage with them more and help them to understand the warnings and to filter them out into their own intelligence, as it were. And with regard to organizations, I think it's very much the same thing. And I know that we have another question that will probably deal with this a little bit more. But I'd just like to come back to alerts again, because alerts were talked about earlier as well. And I'm involved in the European Emergency Number Association, ENA 112, which has been advocating for public alerts on cell phones since the early 2000s. And I visited Boston after the terrorist attacks, and I sort of learned more about their public warning systems and so forth. And this does tie in, I promise you. And we've recently had the testing of the UK's emergency alert systems. If you read the below the line comments from people about this, it's just horrifying how they're taking what is, it really illustrates the complete lack of trust that some sectors have, how they're seeing it as something sinister. What should they be warned about? They don't want to be warned about. You know, we don't need warnings. And that's something that we're really going to have to overcome generally. And I think sometimes that works in organizations as well. People say, well, it hasn't happened before. Part of the problem is convincing people that things can happen. I think COVID will probably have made that point quite strongly for a lot of people, but we mustn't fight the last war. It's going to be something else, as Catia says.
Gianluca, can I just say in support of what Emily's mentioned there?
Yeah, sure.
I think how you respond to warnings is often framed by the lens that you look through, that you actually look through, and by that I mean, I guess in most cases, your experience. Now, I went over to Singapore, for example, in 2017 when I was working with Rolls-Royce, and I asked one of the people out there, I said, "What's the biggest risk?" And he said, "Oh, it's a pandemic." And I thought, wow, okay, that actually wasn't what I was expecting. But I said, talk to me about your preparations then. And what he talked me through was almost what I would describe as the preparation for a response for something like a chemical attack. It was into that level of detail, and they took it so seriously. And I couldn't help walking away from that thinking, wow, we're one company, but we've got almost two really radically different approaches to this. And I said, look, can I just ask you, why are you at this sort of level of detail and forward-leaning planning for this? And he said, yeah, absolutely, it's simple, SARS. So they'd experienced it, they'd learned their lessons, they'd gone to so much detail, forensically almost, in learning those lessons. So to them, the next risk, accompanied by the next warning, was actually very, very real. Now, flip that on its head a little bit. I was once described after swine flu. I was once actually introduced as the guy who's going to tell us why we didn't all die from, quote, chicken flu. So it's your experience as well, I think, in terms of how you tolerate those warnings when they actually land. And I think from a perspective, or from the perspective certainly of my experience of swine flu, I think swine flu was rather kind of like the millennium bug, really. The unintended consequence was that people thought all this hype about a pandemic was just that, hype.
Yeah, that's super interesting. Jeremy, I'm not sure if you want to relate more to the global problem or to what Andy was mentioning now, because for me, the two things are extremely interconnected together. So the way we have an overview of the global development of warnings, and we have or we have not benchmarking, for example, that was one of the questions in the boxes, can orient completely how we deal with it. But is it all?
Yeah, I'm at risk of being a bit parochial because my thinking is probably much more UK and certainly London focused. But yeah, really interesting to hear the panel and agree with everything that has been said. I mean, do global warnings exist? I think my immediate reaction to that would be absolutely yes. How effective they are is obviously a much more interesting question. They clearly, you know, things like climate change, you know, collapse or disruption to the financial system and COVID, they can have these massive impacts, but also they need arguably global responses. So I think they absolutely have a place, but as the other panelists have mentioned, whether they are effective or not for a number of reasons is certainly, there's probably a varying degree of efficacy. So, I mean, Andy mentioned around being overwhelmed by information, and that's absolutely the case. I think there are filters, aren't there, and levels of information. And for me, a global warning, I would expect that. I not to be lazy or but I can sit back to some extent and expect the UK to look at that global warning and that central government to say to me, well, okay, we are making an assessment here around how much of a threat this is to the UK. And I think feeding into that whole conversation around, and Emily mentioned, you know, so much going on. It's not just about identifying risks, but it's also about assessing them. So, you know, what is the scale, what is the potential impact, rather than just having all these issues, all these potential problems thrown at us, and then ultimately prioritizing them. And that's what makes up our risk profile. And going back to what Andy was saying around perspective and you know, perspective and context is king. You know, for the UK, for instance, or perhaps let's say somewhere completely different, where COVID is clearly a major issue for us right now, but in an area where earthquakes are really prevalent and they happen really frequently, COVID might not be the first thing on people's minds. So that context piece is really important for us to bear in mind. I think in terms of dealing with warnings versus alerts, and going back to something Catia and Emily were saying, it's really, I think there's perhaps a spectrum of recency. And again, apologies, because I probably work in the more, I wouldn't say sharp end, because that sounds much more exciting than it is, but I work in this sort of immediate emergency response rather than thinking about these really big issues that actually are slow burn, that can really, you know, have that impact if we don't, and we need to have that long-term thinking. But it feels to me like there's a spectrum of recency where if it's right in front of us, and we found that with COVID, there's much more of a need to deal with the overwhelming information, perhaps misinformation, by providing single points of truth. Certainly for public responders, that has its limitations. Obviously, I would argue that it's really important to say, well, we know this, we don't know that, but then obviously that has to be balanced with, well, you know, what reassurance do you want to give to the public, or how do you want to show that you are, you know, that the government and responders are gripping the situation. But in contrast to things like climate change, that need immediate action but are longer term, and there's probably more opportunity for debate, and that debate is really important to actually to have those conversations, because because to get that message out and to really understand it. So yeah, difficult to marry the two together, and I think that's where we are at the moment, trying to work out how do we marry immediate action with long-term warnings.
Absolutely. Any other comments by the panel on this? So let's do the last question before going through the question from the public. So let's do this quite fast. So more or less sharp, 1 minute each or something like that. So to sum up, are organizations effectively integrating warnings into operational practices? What is your take?
Would you like me to go first, Gianluca?
Absolutely. You are the candidate. You start with A. I'm sorry.
Again, I'll frame my answer around having worked in a number of organizations now, and I'd say the answer to that is no. And I think there's a lot of work for organizations to do to improve the way that they understand warnings. They get the warnings to the right place, to the right person or people at the right time, with the right, I guess, understanding as to, okay, that's so what I mentioned earlier. So what do you want us, the organisation, to do about this, and why should it be a priority, to Catia's point, amongst all the other things that could cause us a lot of pain? And one of the behavioural things, again, for the academics listening in here and thinking about areas for research, one of the things that fascinates me is the organisational behaviour of the individual, particularly around their propensity to share or not share what could be perceived as bad news, either to their immediate boss or to tiers of management above them. Because sometimes I think part of the reason why that message around risk and warnings gets distorted is because sometimes the message is overly managed.
You're not wrong, Andy. I'll try and keep it short and sharp, Gianluca. I can speak really fast. So I'm slightly more optimistic, I think, than Andy, but that might be a personality thing rather than a reality. And I do think, look, hindsight is 2020, right? When something happens, companies do tend to learn, whether but that's not signs, that's not early warnings, right? That's already kind of learning from a pain point. Whether they're actually integrating warning signs, I would say that companies, because of COVID, the positive that it's actually come from it is that companies have restructured a lot in the way they work to become more agile, more flexible, do a lot of different things, kind of trying this future-proofing idea. But I think it was Emily that mentioned people play a huge part in this, the culture of the company, that kind of has to change in general. I do think that a lot of companies are looking at short-term and long-term, but they look at them as separate entities. I will agree with Andy on that one. I think they're looking at what do we need to handle right now? So like, what's the crocodile that's closest to your canoe kind of expression? And then they're telling me, when do I need to worry about the future ones? And then just let me know. So then the triggers actually become a really big point in at that stage. But so I do think that companies are concerned and they're starting to look at different things. It's impossible to ignore things like whether it's climate change or cyber. It's just, you cannot bury your head in the sand. So they have to start dealing with it now before it becomes a bigger issue. I will say just one last thing. There's one thing about obviously integrating the learnings, but I feel like a lot of companies are trying to integrate a lot of, they're saying they want to look at the warnings because they want to make sure that they're able to bounce back if something happens. And to me, that bounce back ability is the worst word, because if you bounce back, you've learned nothing. So you literally need to learn something. So whether it's from the learnings or from the warnings, apologies, or previous experience, it's just about what Andy mentioned, integrating it into your actually daily work, into your culture. That's what's going to make, I think, an improvement in your resilience. That's me.
That's a very good point. Well, there are many very good points. Emily.
Completely agree again, as usual. No, I thought Andy's point about not wanting to deliver bad news is a really important one, because that does hamper organizations from raising the sign, but also one department's warning or threat could be another person or department's opportunity. but you do need to recognize and identify these indicators and treat them with seriousness and look at them from both sides of the coin. I mean, I'd say in answer to the question, I think some organizations do, some organizations don't. I mean, on Crisis Response Journal, if I'm just looking at the latest edition, we have quite a few examples of where companies haven't. You know, there's been repeated warnings. One of the examples was the blackouts in Texas. They've been having they've been having cold weather since 1899. There's been numerous reports as recent as 2011 saying you've got to winterize your energy production and distribution. I'd suggest that you know, those warnings, even though they were actually wrapped up in hazardous tape and large wrapping paper and had flashing lights, they were not taken notice of or integrated. So I think it's about pragmatism, and it's about leadership. It's about genuinely trying to get the systems in where it's almost second nature for every member of, you know, like security in some organizations, it's everybody's responsibility, notably in aviation or something. Really, it ought to be everyone's responsibility to look out for these little aberrations and things that aren't right, report it, and then feel confident that their reports are going to be taken seriously. I'll let someone else speak now.
Jeremy.
Yeah, hi. So, yeah, really interesting. I think a theme of agreeing with my panelists. Yeah, that thing around giving bad news to your boss, I think absolutely. It's something that we're probably all reticent to do, but in reality, is how we become responsive, and if we're not providing that information. But going back to Emily's point, there then needs to be an assessment of it as to, you know, what is the potential impact, what is the scale, and where does it sit in terms of the priorities. And you know, it's a really difficult thing. You know, organizations are complex, society is complex, and I think that when emergencies and crises happen, we should be looking at whether it is a failure of warnings and responsiveness to those warnings, but also bearing in mind the human aspect, the fact that, you know, there are so many multiple warnings. How do we make sure that, I'm not sure we'll always, I don't think I'll ever be out of a job. I think there will always be emergencies. And I think that, you know, it's not always about whether they happen or not, but it's whether we respond early enough to them. Have we contained them rather than made them worse? I think in terms of companies, sort of private sector organizations, I think there's an element of existentialism. I think these days, if they aren't responsive enough, and go back to Emily's point, and I was going to say the same, you know, turning warnings into opportunities, and Catia's point around, you know, not going back, you know, bouncing back, but actually coming into the new normal. That responsiveness now, I think, for certainly for the private sector is really critical in order for them to be able to survive. But I wouldn't say that the public sector are oblivious to that, and I think that there's a real, not just, and I think it's not just the public sector, but also private sector coming together with the public sector, that need to not just respond to warnings internally, although that will be a part, but also responding to them collectively and having that communication to understand, well, okay, you know, how do we understand that warning better? What is our assessment of it, and is our response internal, or is it something we need to do collectively? And there's a whole host of work. It's an exciting time, certainly in the public sector, although that link between the public and private is decreasing. You know, that, as I say, that response to warnings isn't just, well, okay, it's the emergency responders. Actually, businesses and communities, organizations are a key part to that response. But I would say it's a really exciting time to be in that. And certainly things like how we better inform the public, public risk communication, and whole society approach to warnings and resilience is something that is being driven at the moment. So there's at a UK level, there's the integrated review, which relates to the National Security Risk Assessment. So there's a lot of work being done there. The House of Lords are taking that really seriously, based on recent experience, particularly COVID, looking at how how is risk communicated from central government to local responders to the public. There's a lot of information about that, and some of that committee, that House of Lords committee, is available on the website for people to have a look at. Review of the Civil Contingencies Act is up and coming, and we're expecting a lot of those recommendations to come to us pretty quickly, probably March of next year. And a lot of that is around public risk communication and, like I say, whole society, although they are buzz phrases that have been around for a long time. So I'm not expecting panaceas, but hopefully we'll continue to improve and make things safer for all concerned.
And I think very briefly, Jeremy, I think it's fair to say that the private sector, particularly large corporates, are very welcoming of the language that seems to be coming out of those reviews in the UK, because there's overt mention now of the importance of the role of the private sector in that wider societal response to significant risks. I mean, Rolls-Royce was a classic example, wasn't it, when it was turning over production of aero engines to ventilators early on in the pandemic, for example. So yes, I do think it's an opportunity to recognise the role that the private sector has.
Thank you. So we need to wrap up, and let's try to have a couple of the question answer. So I think we already answered about the example of power failures with Emily, but how do we build societal trust in our warning systems, and how do we reach, we are sure that we reach also small, medium enterprise, based on your experience? So how do we build societal trust in the warning system, and how we are sure that we reach other realities such as small, medium enterprise, or I can think about a humanitarian sector?
Well, the quick answer from me would be, goes back to that point around being a single point of truth, but also being clear about what we do know and what we don't know. Responders, both public and private, collaborating and not contradicting each other, so sort of collective messaging. In terms of how those, sorry, can you just say the second part of the question again?
How to involve more small, medium enterprise to be sure that we are reaching out.
So those businesses, and I think Andy really alludes to the fact that there's probably more work to be done in this arena, but certainly both locally, regionally, and in central government, getting through, having that dialogue with businesses, because they are part of the community, they're part of society, and a critical part. We all work, or the vast majority of us. There's a social conscience approach to business these days, otherwise businesses wouldn't survive, and we really need that involvement. So small and medium-sized enterprises, there's responsibilities on specific response, communicate with them. So for instance, local authorities will do a lot of work to promote business continuity with those small businesses. That's a statutory responsibility for local authorities, and within local resilience forums, businesses will be tied into those. They certainly should be.
Anybody else? Please.
Yes, right. I mean, for the first part of the question, that's just such a massive question. We could do a whole session about that anyway.
Yeah,
I'm not ignoring it, but I know that the questioner actually reads CRJ and knows that we do cover this quite a lot, so I'm not going to repeat my views on that. SMEs or micro businesses, that's a subject that is really, really close to my own heart. We're a small business. Everyone I know runs a small business. And I've seen firsthand the stresses and pressures and so forth. And we've done webinars about this. They're also not used to being, they're also very used to being overlooked in any sort of response, any sort of government planning, any sort of response. What they do have is they are incredibly resilient, because on their daily operations, they're operating at peak stress anyway, most of the time. They're used to Andy's so what question. Their question before that is what if? And they sort of work on that. And it's really important to understand that one size does not fit all well-meaning, well-intentioned involvement and assistance in sort of resilience and continuity doesn't necessarily work for the sole trader who's probably doing 5 jobs at once already and doesn't necessarily want to have more, oh, here's a lovely resilience plan for you to fill out and risk assessments and all that sort of thing. They're too busy trying to survive. So there's got to be more creative engagement, I think, with SMEs. And that starts with the recognition of their multifaceted nature of the job, everyone's role within those organizations, and how you can't pigeonhole them. That's one thing I'd really say, and I think they're very much overlooked. Off my soapbox now.
Thank you. Catia, Andy, do you have any last comments?
Nothing really to add from me, Gianluca.
Catia?
I was just going to say it's honestly, it's all a learning experience, to be honest with you. So we work with a lot of small and medium-sized companies as well. And I think especially through crisis situations, I wouldn't also take away the responsibility that maybe other private sector companies, maybe bigger ones, could also support. I think putting it all in the public sector might be a lot. I think there's a lot that we could actually share and do. And it was a great, proud moment, if you will, within the industry, the tourism, hospitality industry, during the pandemic, to see how everybody kind of pulled together and was, figuring it all out and sharing resources. And I think we already did that for areas like counterterrorism and so on. But there's a lot of stuff that we can actually share with each other and learn from each other. And I'll be honest with you, you're always learning. So somebody might have a brilliant idea that could work on a lot of different ways. So I just find it a fascinating area that we should probably work on together more, rather than we tend to be pulled as in, you're this size, you work with this people, you this size, you work with those people. So just my 2 cents. I think it would be helpful to do more of that.
Thank you very much. I completely agree. This panel was extremely interesting. First of all, we managed to arrive to the end without a bloodbath. This is a great result considering the topics, but also it's been extremely engaging. I want just to put down some concluding remarks in 1 minute. First of all, when we are talking about warnings, early warnings organization, at the end of the day, as one of our questions flagged, it's not just a matter of the hazard itself, it's a matter of which are the root causes. And what came up from all your experience at the end of the day is that to go beyond and seeing deeper and seeing wider and connect things that are not necessarily linear together. So use your lateral thinking and your critical thinking. When we're thinking about time, it's not what is happening now, it's what's happening in the future, how we are going to prepare for what we don't expect. And the only way to deal with it is, again, exercise how can we work together, understand where we are vulnerable together, and how we can act. And act being more efficient and produce research that is more oriented also to produce the boost class strategy, but also something practical for you in the day-to-day basis and in the medium-term scenario. In conclusion, before they cut us off, there was one of the questions, maybe next conference responding to early warnings, which, who, when, how, yeah, maybe. We are working on that. And again, the challenges are partially the same. How do we connect with the root causes? How we transform and we act on the root causes? So disasters are not natural. We are going toward an era of interdependence, interconnectivity. And what we are doing every day, how we see strategy, how we connect future, present, emergency response and adaptation are all together, and it's how we are transforming practices right now. So I wish to thank again all the panel. It has been amazing. I learned a lot from you, and I hope all the public and all the attendees learned as much as I did.